Hi, and welcome to this on-demand learning on taking the next step in becoming a generative board of directors. First of all, let's thank the Health Center Association of Nebraska, or HCAN, for sponsoring this video. To learn more about HCAN, please click on the link below. So let's get right into it. Let's think about, where is my board at? So there's 3 different types of nonprofit boards that we're going to be learning about. 1, fiduciary boards, 2, strategic boards, and 3, generative boards. So first and foremost, fiduciary boards of directors. These boards are only focusing on oversight and policy. So some of the questions that they may ask are, have we checked all the boxes that HRSA wants us to follow? Normally, it's based on the Health Center Program Compliance Manual and Site Visit Protocol. For more information on these resources that I just named, please see the resources slide at the very end. Finally, fiduciary boards of directors use resources effectively and efficiently. So some of the questions that they may ask are, can the budget support what we are doing? And then finally, really looking at clinical data to see whether, as an example, diabetic patients may have good control. Fiduciary boards of directors have minimal discussion documented in board meeting minutes. The next one is strategic. Strategic boards focus on strategic priorities and drivers for the organization. They also use the strategic plan as a guide, and really may ask themselves, are we following what we said we would do? The structure of the board is flexible, and what that means is committees are formed around strategic priorities. And finally, the board and staff discuss strategic data from multiple sources. So what this means is, when you're looking at your clinical data, your information may also be compared to local, state, national, or even other health centers with similar organizational size. Finally, we want to look at generative boards. This type of a board is a very visionary board, and the thought is that they're actually looking at the bigger purpose. So the board thinks through and picks apart different organizational components to challenge and improve the health centers. Meetings are spent seeking more information, questioning assumptions, and challenging conclusions. And by doing so, they're also able to advocate for solutions based on analysis. And if you notice, the why doesn't matter. It's really the meaning behind it. So as an example, if you're looking at your clinical data that you receive at your board of directors meeting, one question may be, what is the meaning behind the increase of diabetes in our community? Maybe another question is, what do we want our health center's legacy to look like? Remember, a generative board of directors will look at a big picture and really have discussion and questions versus current operations and strategic priorities. Finally, take a couple minutes and ask yourself this question. When I think about my board of directors, what type of board of directors do I have? Fiduciary, strategic, or generative? Remember, we want to be able to build all the way up to a generative board of directors. So let's explore a little bit. How do we move towards a generative board? Well, one, we can try and use a consent agenda. And essentially, a consent agenda, what that is items that do not need any discussion or routine procedures or are already a unanimous consent can be put together under one motion. This allows the board to approve items together. Examples of items could be approval of minutes, routine matters such as committee reports, or reports provided for informational only. Please remember, anything that is a HRSA Board of Directors requirement should not be in the consent agenda. And finally, items can be pulled from the consent agenda for discussion from the board. So take a couple minutes and look at some of these questions. These are some examples of generative questions that you could use at the end of your board meeting for discussion. So how do we get there? How do we move towards a generative board? Well, number one, evaluate your health center's mission. Is it the same mission from when the health center started? Does it reflect your health center's current practice? Number two, is your health center working in the future? Perhaps you're looking at other lines of businesses, maybe investments, foundations. And finally, maybe you're looking at your patient satisfaction results and your patients are asking to look at different service lines or locations. So how do we get started? One, start the discussion. Discuss generative concepts with the CEO and your other board members. Set a date to implement small changes. Number two, if you haven't already started, implement a consent agenda. Make sure, though, you evaluate the length of your board meeting. You can pilot the consent agenda template. And don't forget, make sure you set expectations of the board members and staff. Board members must receive and review information at least 7 days in advance. And finally, staff should not read the report to the board, but obviously provide highlights. The third way is to add generative questions at the end of the meeting. Allocate time to each section of the meeting to leave enough time for generative discussion. Don't forget, generative questions should be based on current or future events. Maybe every month is a little too much to have generative discussion. Perhaps determine to have generative discussion on a quarterly or biannual basis. And then document discussion in the board minutes. Finally, here are some resources that may help you to learn to become more of a generative board. Thank you so much, and I hope you have a great day. If you have any questions, feel free to contact me or HCAN.